guys, we are at the end of the day today, and it was a wonderful day. We had a lot of lasers and fillers in the morning, and then I filmed the doctor's show this afternoon. And then I came and I got to see one of my beautiful patients who's thankful enough to let us film. And the reason I think it's great that we're showing this is we're doing a combination treatment for a very common condition that a lot of patients have as they age, especially my lighter skinned patients with lighter eye color, lighter hair color. They get a lot of redness that appears out of nowhere. Sometimes it's hormonally related, sometimes it's sun from over time, years before, or sometimes it's just genetic and frank bad luck. And so what we're using right now is something called Aerolase. This is the first step in my process for her of doing a combination of things to make her skin quality better, to prevent skin cancer and remove sun damage, but also decrease the redness, okay? This is a microsecond YAG laser, which means that the laser is actually going very deep into the skin and heating it. So do you feel heat? Yeah. But it's not burning the surface, which is really amazing. This type of technology, a YAG, typically doesn't do that. It usually burns the surface. So what this allows us to do is it basically tells the body's blood vessels and pigmentation to get removed, to lift to the surface. And so we do it in a pattern area. And we just follow this pattern. Do you have any questions or comments?
Yeah.
What are they saying?
Not yet.
Oh, not yet. Okay, good. And we follow this pattern. We do it to enough heat to where she's going to get not only a rejuvenation, sort of anti-aging effect, the tightening of her skin and such, but she's also going to get the decreased redness, which is what we care about the most. So we follow these passes, and this Aerolase device is really unique. What's great about it, depending on the settings, is you can treat redness, you can treat hair, you can do hair removal, you can do skin tightening and rejuvenation, you can do blood vessel removal, and you can treat pigmentation and melasma, as well as scars. So there's a lot of things you can do with this treatment. So this is our first step. We preheat the skin to get these blood vessels stimulated.
What causes redness and rosacea?
Well, that's what we just said. We don't know. Frank bad luck, genetics, hormone changes. This can just happen, unfortunately. And unfortunately, no matter what you do, you're going to have ongoing treatments forever. We try and make as much improvement as we can in the first 3 to 6 treatments. Turn your head all the way to the left. And she's actually made major headways. You know, when someone looks at themselves every day, they see all this. But when she came in originally, she was bright red. I mean, literally. Now it's just subtle, normal. And this can be done very frequently, actually. You can have patients do this with their facials. We call it a laser facial. And that can be done every couple of weeks if they wanted, to just speed up the process and keep it really under control. The second step in our process is going to be to do direct vascular laser treatment. After about 150 pulses, we have to wait a second because the skin heats up. You can feel the difference. It's pretty dramatic. When I cool it down for a few minutes, this is a solid state laser, so it requires that. Second step in the process will be to use a true vascular laser, which focuses a little more superficially in the skin to all these little dilated vessels. If you come in really close, you can see some small dilated vessels here. These are what we call telangiectasia, matte telangiectasia, diffuse sort of redness. When we treat those, we're going to treat those independently with what's called the XLV laser, but you can also treat that with other lasers like IPL, the Venus Versa, yellow laser, or pulse dye laser. We happen to have all of those. These are the most targeted. This is also the most safe. I want to keep her safe, just like I would treat my mom. This is how I'm going to treat her. So we don't want to burn. She gets very nervous. We're going to make sure we treat, And then the best thing that she's also getting with the Aerolase, she's getting some skin tightening. So to me, she's getting an anti-aging effect, which I'm very happy with. I want her to get, feel more youthful, The skin changes in women very frequently in the 35 to 45 range and older because hormones change. And unfortunately, it has a huge effect on the skin, not only with skin laxity, but also with blood vessels and pigmentation. So you really need to rejuvenate it, you know, doing things like micro-rolling at home, retinol masks to stimulate exfoliation. For her, we have to be really careful about her skincare products because she's very sensitive. So we have to use very specific products. So we're using things like Rosacea, which is a fish enzyme product that helps calm the skin. Something called MD Rejuvena, which is a chlorophyll-based product, which is organic and natural and calms the skin down. It has a pore reducer and a redness reducer that's really great. But what's amazing is, you guys, look, we're on the second pass, and already the redness has decreased. How's the heat?
It's hotter than last
Before,
time.
yeah,
but
because we went up.
Yep.
But it's not terrible.
No.
Okay,
it's
good.
tolerable.
But you know it's there.
Yep.
And what's amazing, when we look at your skin, nothing's happening. When I look at you right now, it looks like nothing's happening. But you know stuff is happening because you feel the heat. Because it's bypassing the top level of the skin, and it's going deeper below the surface to stimulate skin tightening and to shrink, and then to shrink the blood vessels. The other benefit is women sometimes get a few hairs as they age, you know, on the chin and mouth area. We're going to get rid of those. Those will go away with the Aerolase.
Yay.
I know, everyone hates those. It's true. So we're going to do one more pass. See that? You guys saw that hair just disappear right there? See? You probably felt that a little more. And look, right there, hair. Go back, we'll see it again. Okay. Bam, got the hair. Everything's doing great. You can see a nice, mild redness. It's exactly what we want. We want to build up that heat under the surface. When you have acne, some people call this Neo-Clear treatment. But regardless, whatever, this is a heating type of laser that's very focused on specific things like redness, acne, pigmentation, fine lines, and tightening. A lot of my celebrities do this treatment because they literally walk out of here looking fine, and they go right to Equinox. Totally fine. Isn't that crazy?
That's crazy.
I know, there's no issues. They want stuff that can help them without having a lot of downtime. I'll turn all the way to the right. We're going to the other side. The key to this treatment is patience. You have to have patience. You got to go nice and slow, nice overlap. Again, we wait after about 150, 200 pulses. Let it cool down. I can feel over here, very hot. That's great. We love that. Wish you guys could feel this, because it doesn't even look like anything happened. You know what I mean? Almost looks like nothing happened, but she's got an amazing outcome. So, and even the forehead's still warm, which is great. So that means we know it's working. Okay, now we go back. $90. Each pulse going to bring a nice amount of energy. Again, we're going to get some of those hairs. See, I'm sorry, we're getting those. See those hairs going away, you guys? You can see them, they're smoking up. They hurt a little bit, right?
Yes.
But it's not terrible.
Yes.
I know. This actually laser was designed for darker skin. So my Middle Eastern patients love this laser, and my Hispanic, they can have hairs, because they can use this without burning their skin, which is amazing.
It is.
A lot of lasers like the Alexes and the diodes, even though they say they can use them on dark skin, we've seen many times issues in patients. Again, going over the gel area a little bit more to get some skin tightening. As she's here, we might as well give her that, you know. Even though the focus is mainly redness, we still want to make our skin look better and be healthier and be tighter. Anyone asking anything? Instagram?
For people tuning in, which laser is it?
So this is the Aerolase microsecond YAG laser. The key point about this is it's delivering a lot of energy under the skin without you even noticing because it's not burning the surface. So you can even see when we go over the hairs, you can see the smoke, right? It's working. You know it's working. You want that?
Yeah.
We'll do your next. Do this next.
Burn all my hair out.
What?
Just burn all my hair out.
I know. So all my dark skinned women say, get rid of those hairs. No, and this removes pigmentation. So if you have pigmentation in hair follicles or in acne, this is the treatment. It's awesome. So we want to heat, so you can feel it. I'm going to feel your skin. Very warm. That's
Yes.
great. That's what we want. That's perfect. And the response she's getting is perfect. What are you saying?
Can it be used for scars?
It can, but it has to be in a different setting. We would preheat with this laser, with this tip, and then we would go to the 2mm focus tip and blast the scar. Turns very dark, black and blue. Remember, the key word is patience. Go nice and slow. Work pass. Again, getting those hairs over time. You do the lip, it plumps the lip up. Sorry. It heats up a little too, but it plumps it. So we're getting all that redness. Beautiful. One more pass. And then she's done. It's about a 10-15 minute treatment or so. And then we're going to move into step 2.
Does she need numbing cream?
With this one, you usually don't. We're going to another 150. You're going to wait about 10 seconds and feel your skin. Beautiful. With this one, you don't, but because we're doing a combination of things, we are using the numbing cream today. But I like people actually not to have much numbing cream with this because I want to know what they feel. You know, I want to know what their feeling is. Because if it gets too hot, you want to bring it down. Because heat can build up in the surface and cause blisters and burns. With any laser, regardless of how safe the laser is in general.
Does it affect filler that's in the
Not at all. If anything, I think it helps it a little bit because of collagen production. And decreases swelling if there's swelling from fillers.
Can you do this as a series?
Yeah, I mean, this is something I tell people to do monthly when they do facials, but if we're treating rosacea, we do it in a series of 3 to 6 of them, and then we get on a maintenance plan. Perfect. So the diffuse redness is done. That's the underlying, we call it preheating, global targeting. Okay, and now we're going to move to our focused heating. Stay tuned.